Mr. Speaker, on 25 September 2025, the US announced a 100% tariff on any branded or patented pharmaceutical product with effect from 1 October 2025, unless companies are building manufacturing plants in the US. It is unclear whether they will be subject to tariff once their building works are completed. The implementation of this tariff has since been delayed to allow time for pharmaceutical companies to negotiate exemptions with the US administration. The pharmaceutical industry is a key contributor to Singapore's economy, with 8 of the top 10 global pharmaceutical companies having manufacturing and research and development activities here. Between 2022 and 2024, Singapore's pharmaceutical exports to the US averaged $3.7 billion per year. These are primarily active pharmaceutical ingredients instead of finished products like tablets and capsules. We do not have a breakdown by branded and non-branded pharmaceutical products. We have been engaging Singapore-based pharmaceutical companies on the impact of the US tariffs. Many already have plans to build new capacity or expand their existing facilities in the US and are awaiting further details from the US administration to confirm that their plans could qualify for tariff exemption. We are also in discussion with the US administration on a preferential tariff arrangement for Singapore's pharmaceutical exports to the US and will provide an update when ready. On the immediate support measures for Singapore businesses, including pharmaceutical companies, a written reply had been provided to a similar question raised by Mr. Saktiandi Supaat at the sitting on 22 September 2025. We are closely monitoring the situation and stand ready to provide further support as needed. Our economic agencies continue to attract new manufacturing and R&D investments from global companies, provide support to our local enterprises, and create good jobs for Singaporeans. However, the US tariffs and related global developments do point towards a changed world with greater uncertainty. The 5 committees undertaking the Economic Strategy Review, or ESR, they are developing recommendations on the strategy to grow our economy for the longer term, and will provide an update in due course.
I have 2 supplementary questions. 1, what proportion of Singapore's pharmaceutical exports to the US comprises active pharmaceutical ingredients or intermediates? And 2, are these categories subject to the same 100% tariff or eligible for any exemptions? Thank you.
As of 2024, 13% of our domestic exports to the US were pharmaceutical products, and this makes up about 19% of our pharmaceutical exports to the US. It is unclear at this point on the details of the tariffs differentiating between the patented and the non-patented products.
I'd like to ask what may be the long-term knock-on effects in this pharmaceutical industry, and given the government has invested quite a lot of money in this area, would there be any strategies to diversify our investments?
It's actually really too early to tell if there will be a change in the manufacturing and R&D investments in Singapore arising from this set of new tariffs on the pharmaceutical products. But also, I think we have to understand that beyond tariffs, companies would consider a range of other factors in making their investment decisions in Singapore, including our political stability and rule of law, pro-business environment that we have here, global and regional connectivity that we will continue to enhance, and of course, best-in-class infrastructure and access to skilled workforce. And we will continue to look at how we can diversify sectors in our economy. And as I said earlier on, the ESR is looking into this and will be providing an update on the strategy going forward.
How would the new US pharma tariffs affect our healthcare system, particularly medicine availability and drug pricing? Are Singaporeans seeking care likely to face higher costs? And will MTI, together with MOH and HSA, conduct a formal assessment of near-term risks to common medicines and how tariff costs may pass through to consumers? Thank you.
Well, the Singapore government is still currently in discussion with the US on preferential tariff arrangement for our pharmaceutical exports to the US. I think it is really too early for us to tell whether prices of pharmaceutical products in Singapore will be affected. But we will certainly make sure that healthcare will continue to be accessible and affordable for Singaporeans.
Thank you, Speaker. Just two supplementary questions for MOS. I think the first is, I think as early as in May, I think DPM has mentioned that Singapore is pursuing preferential tariffs to the extent of even zero tariffs on pharmaceutical exports. And so from that perspective, now that we are already in October, is the idea of having zero tariff still a possibility given the current environment? And secondly, again, more from a longer term perspective, while companies like AstraZeneca, Pfizer, some of these big pharma companies are able to negotiate their own deals with the US. But more broadly for Singapore as a whole, given that the EU and Japan already have their own tariff deals with the US, for Singapore's perspective, if MOS can actually share the latest updates and what are some of the impediments to a deal from the US administration? Thank you.
We are still having negotiations with the U.S. administration in particular. DPM Gan just had a virtual meeting with U.S. Secretary Lutnick last week on a broad framework, and the details are being followed up. The negotiation details are confidential, and I'm sure Speaker and members in this House will clearly understand this point. I think we also have to take note that the preferential tariff rates secured by countries like Japan and Korea for their pharmaceutical exports were part of broader negotiations with the US on reciprocal tariffs. We have to be realistic at this point, but at the same time, we are working our best to negotiate for the good of our Singapore economy and the companies here. Thank you.
My concern is about how we can continue to attract investments, especially pharmaceutical investments into Singapore with this announcement. So can I ask the MOS whether MTI or EDB see that to have an impact on how we attract new investments, whether it's from existing companies or from new companies? And secondly, how also that will impact our aspiration to be the R&D center for drugs and vaccines discovery, whether that will impact that aspiration as well.
Well, I will answer both questions together. Indeed, it is in our interest to try to continue to be an attractive place for investments and R&D in pharmaceutical sector. Under the RIE 2025 plan, which is on research, innovation, and enterprise, we have committed $28 billion for research and innovation with the intent to accelerate human health and potential as one of the key focus areas. This includes funding to drive research and translational efforts in biotech and life science sectors. We will be announcing the research funding under RIE 2030 later this year. And at the same time, we will continue to invest in talent development, both our local as well as drawing foreign talent, so that we can have a competitive sector to attract businesses and R&D to Singapore.
I thank MOS for the statement, but just want to clarify that, are there any companies right now that they are looking to come into Singapore, but because of this tariff, they are still deterred or just still consideration?
I seek Speaker and also members' understanding that the negotiations are still ongoing, and I think it is sensitive for us to disclose information about companies that are considering coming to Singapore at this point.
Presumably, MTI has a plan for what it will do should negotiations end up being somewhat less fruitful than we will all hope. Would the MOS be willing to share if there are plans to expand to third markets that they hope to target with our pharmaceutical exports? And if that was the case, whether she would be willing to share more details about which ones these may be?
Well, regardless of the outcome of the tariff negotiation, I think Singapore will continue to look at how we can go to more markets where we think it makes business sense for our pharmaceutical exports. Thank you.